Sometimes I might recommend against surgery. Some plastic surgeons and cosmetic practices will have free consultations. Others do not. So like in my case, I think that it's overall a good thing to charge for consultations because, it is my time and that is worth something. So even if the patient ends up not doing surgery with us, at least they'll be informed about, my overall impression and my opinion on what they should do. And sometimes I might recommend against surgery. And for many patients, that is something that they're not always prepared to hear, but might be the most important thing that you will hear, right? Because someone will always say yes. And if someone's not a great candidate, I always just kind of lead with my sort of moral, ethical compass rather than, just trying to make more money. And sometimes that means turning people away, and not everyone's ready for that. From a patient's perspective, not everyone wants to hear that. So for that opinion, for that time that we spend talking for me to evaluate a person for a specific procedure, in my opinion, that's worth something. But, I think every clinic makes their own decisions on whether or not they charge or don't charge for a consultation. As a general rule, clinics that are busier, that, are sort of booked out more, will start to charge consultation fees to be able to control that overall flow. Because if you just have free consults, your schedule gets filled up with people who, may not be as serious compared to someone who's willing to pay for your opinion. So at least that's been my experience. When I started the practice, I also did, free consults because I didn't have too many patients. So, you want to keep that barrier to entry very low. And I feel like as the practice has gotten busier, that barrier to entry, it continues to increase, right? Because we want to be able to provide the best possible service, and there's only one of me in the practice, and I have a small team, and everyone does their best, but we can only accommodate so much, right? So at the end of the day, a cosmetic like private practice is essentially like any other business in that it comes down to supply and demand. So if you have limited supply and a good amount of demand, then you're able to raise your prices. If you have limited supply but not as much demand, then the price might come down. So it's really like market forces that determine a lot of these financial decisions, including whether or not to charge for a consultation.